To extend debate, looking to the member from York Southwestern.
Thank you. Thank you, Mr. Speaker. It is an honour for me to rise on behalf of the decent, hard-working people of York Southwestern who sent me here. Here, Mr. Speaker, we are again tonight debating extension of Dr. William, Chief Medical Officer of Ontario. Back in July, the 21st, to be specific, the news first broke to the public that Dr. Williams will be retiring. His 5-year term started under a Liberal government had come to an end. Media reports at the time described his style over his term as mild, reserved, indirect, and cautious. If those traits are the perfect one for a Chief Medical Officer of Health, I would suggest that those very same traits of being mild, reserved, indirect, and cautious would not serve as well during a global pandemic. But we are not here tonight to speak to the suitability of Dr. Williams as a good Chief Medical Officer of Health. We are here tonight because despite media reports in July saying Dr. Williams was retiring in February, this government here is now last minute trying to rush through an extension of Dr. Williams' contract. Now, whether Dr. Williams is a good Chief Medical Officer of Health or not is not truly the point. The point is that this government is always slow to react, always a day late and a dollar short when it comes to action in this province. A responsible government or a competent business model, knowing that a mandated retirement was nearing of a person they considered valuable, that government would have months ago started the process of looking for a replacement, especially during COVID pandemic time. One would think any government would not leave themselves without the best Chief Medical Officer of Health they could find. Well, Mr. Speaker, it seems this government, this majority Conservative government, with all the powers that go with that designation, didn't think of replacing Dr. Williams or how that process would work until this very week. This week, Tuesday, with no notice to the official opposition, this government sought a rubber stamp of their last minute, flying by the seat of their pants, governance and COVID crisis management. They wanted us to extend Dr. Williams' contract. Mr. Speaker, we on the official opposition side of the House are so tired and worried of this government's antics and inaction. They are upset when we don't go along with their making it up as they go along policies. Who waits less than 3 months before a key member of their medical response team is set to retire to decide what they will do to replace them? The people of this province has no confidence in this government. It's handling the pandemic, and neither does the Auditor General. Citizens need to feel confidence in their government, and never more so than during a pandemic, a global pandemic, the likes of which we have not experienced. We get mixed messages every day as the member from Etobicoke North stands at some of the manufacturing facility or bakery to give his daily COVID updates. One day, it is Ford railing about the COVID lawbreakers and how he will come down hard to the next day with the Premier saying he sympathizes with the businesses, lawbreakers, and it keeps him up at night. For Ontarians, it is mixed messages that keep them up at night. It seems to most people that given the choice between the economy and public health, that dollars always win the day. My colleague from Timiskaming-Charain always has unique insights, but today I liked his comments regarding the Premier's assertion that Dr. Williams is the perfect dance partner and you don't change in the middle of a dance. My esteemed colleague stated that Dr. Williams is in fact the perfect dance partner because Doug Ford is the one who gets to lead. Last night, the official opposition tried to amend the government motion with what I thought was a well-thought-out and reasoned amendment by our health critic from Nickerbelt. The idea that the next Chief Medical Officer of Health would be selected by a bipartisan committee and would be an independent employee of the legislature as opposed to working and reporting to the Minister of Health is very sound. The Chief Medical Officer of Health should be the best candidate all parties of the House agree on, and they should operate with complete independence. Is that a bad idea? Mr. Speaker, I don't think so. I think not. The only people not wanting this is those not wanting transparency and the ability to reward political friends. Many of us on this side of the House were curious as to why the government was looking to rush this extension of the Chief Medical Officer of Health through and why the government side was so clearly angry as they are tonight with simple questions and statements about the Chief Medical Officer of Health. It is today clear, after the Auditor General's Downing report about this government's COVID-19 response, the performance of the Chief Medical Officer of Health, that the government hoped to rush Dr. Williams' extension through as soon as possible. And lacking the transparency, this government always looked to avoid. Again, Mr. Speaker, this debate has always been about process. And this side of the House insists process dictates that all party committee determines the candidate and that the Chief Medical Officer of Health is independent of the government and only answers to the legislature, the whole legislature assembly. Last night, the government ranted and railed that even though Dr. Williams reports to the Minister of Health, he is free to speak his mind. Well, Mr. Speaker, let us look today to an independent officer of the legislature, the Auditor General, whose report was not only condemned by the government, but the Premier and Health Minister both attacked the integrity of the Auditor General, Bonnie Lusky. Now, the member from Ottawa West, Nepean, rose last night and gave the credentials of Dr. Williams. I have no doubt Dr. Williams is accomplished in his field, but in fairness to the attacks by this government on the Auditor General today because of a report they didn't like, I feel fair time is needed. Bonnie Lusky became the 13th Auditor General of Ontario on September 3rd, 2013, after having previously served as Provincial Auditor of Saskatchewan and Deputy Auditor General and Chief Operating Officer of Manitoba. Lusky has held senior positions in both the private and public sectors during a 25-year career spent in 3 provinces. She has extensive audit, finance, risk management, and governance experience. She served as the Deputy Auditor General, Chief Operating Officer for the Office of the Auditor General of Manitoba, and the most recently as Provincial Auditor of Saskatchewan. She also held a variety of senior roles at Manitoba Hydro and served as Chief Auditor Executive of Manitoba Liquor Control Commission. A native of Winnipeg. At Winnipeg, we have something in common because she also went to the University of Manitoba with a Bachelor of Administrative Studies honors degree, subsequently obtained her designation as a chartered accountant while working with Coopers and Lembrand, now PricewaterhouseCoopers. She also has a master's in business administration and is a certified internal auditor. In 2017, she was named a Fellow of the Chartered Professional Accountants of Ontario. Liske is currently a member of the Canadian Council of Legislative Auditors and over the years has actively participated in many professional and volunteer not-for-profit organizations. She has also taught auditing courses in Toronto and overseas. Mr. Speaker, the Auditor General is more than credible, and if she was seeking an extension and I was able to support, I would do so. If the government is so intent on attacking independent officers like the accomplished Auditor General, why would some working for a minister such as Dr. Williams dare raise their voice in dissent? The anger and invective raised towards Auditor General Bonnie Lisk today was vicious and reasonable. I was shocked to hear the language used by this Premier and the Minister of Health. I will use the rest of my time giving voice to Bonnie Lisk, Ontario's esteemed Auditor General, and I will remind the government side that it takes many sides to a discussion to arrive at a good conclusion that will benefit the province of Ontario. Do not let pride or hubris be your downfall. Now, the Auditor General Special Report. Ontario's COVID-19 response faced systemic issues and delays. The Auditor General, Bonnie Lisk, says the province's response to COVID-19 in the winter and spring of 2020 was slow and more reactive relative to other provinces. The auditor looked at three areas: emergency management and pandemic response, outbreak planning and decision-making, and laboratory testing, case management and contract tracing. It found a number of contributing factors leading to this slower pandemic response, including outdated provincial emergency plan, insufficient staff, and significant changeover in leadership at Ontario's Provincial Emergency Management Office, as well as systemic issues such as the lack of lab surge capacity and outdated IT systems. A new governance structure to respond to the pandemic was not presented until a month after the state of emergency was called. The Auditor General says much of this was avoidable as Ontario failed to act on key lessons identified of the 2003 SARS outbreak that had not been implemented. For example, the SARS Commission's final report identified taking preventive measures to protect the public's health, even in the absence of complete information and scientific certainty, as the most important lesson of SARS, is stated Lisk. Following this principle means taking informed, decisive action early. This is not what the auditor found. Instead, we found systemic issues and delays in decision-making. Even after the state of emergency was declared, the auditor observed a command structure that was overtly cumbersome, having expanded from 21 people to 500 members at the time of this report being drafted. As well, the command structure was not led by public health expert, and Public Health Ontario played a diminished role in the province's pandemic response. In addition, the Chief Medical Officer of Health and other public health officials did not lead Ontario's response to COVID-19. Auditors concluded the Chief Medical Officer of Health did not fully exercise his powers under the Health Protection and Promotion Act to respond to COVID-19. For instance, it was the province, not the Chief Medical Officer, that finally issued an emergency order in early October 2020 to require masking for the general public. The audit also concluded Ontario's COVID response was often disorganized and inconsistent because of the variations in management and operations among public health units. Public health reform recommended about 15 years ago by the SARS Commission had not been fully acted on, Mr. Speaker. In May 2002, Ontario's 34 local public health units jointly issued a document stating that there needed to be more direction and regional consistency. As of the writing of this report, the Auditor General states, these 34 public health units were still operating independently, and best practices were still often not being shared. The report also points out that the Minister of the Solicitor General did not implement Auditor General recommendations to the previous government, that is, the last 15 years. That was bad. From 3 years ago, to regularly update and finalize its emergency response plans. As well, the Minister of Health had not acted on the recommendations in the 2003, 2007, 2014, 2017 audits to address weaknesses in the public health lab and information systems. Had 3 recommendations being addressed, Ontario would have been much better positioned to respond to COVID-19. Auditors were also concerned that laboratory testing, case management, contact tracing for COVID-19 were still not all being performed in Ontario in a timely enough manner to contain the spread of the virus. These are the 3 critical things needed to control a virus. According to the international best practices and successes, is dependent on having effective integrated information systems that can quickly capture and communicate information. Mr. Speaker, this, along with clear case management and contact tracing guidance, were lacking in Ontario. For example, the Auditor General states, between January and August, all but one public health unit could not meet the target of reporting lab test results within a day of specimens being collected, 60% of the time. We also found public health units in Toronto, Ottawa, Bill Region and York Region were failing to contact people in a timely manner. After testing revealed they were COVID positive between March and August 2010, stated the Auditor General. This may have led to further exposure and spread of the virus. The need for properly resourced public health labs in Ontario and better information systems had been pointed out years ago by experts and others, including our office, she says, with little to no action taken until the onset of the COVID-19 pandemic. If these long-standing concerns had been addressed earlier, the Minister would have better information to enable it to adjust testing eligibility criteria to the highest risk Ontarians and probable cases, and Ontario would have responded to COVID-19 more quickly, more effectively and more efficiently. Our discussions during our audit indicated that decision makers are willing to learn from the past, but recognize that that improvements continue to be required, and we hope that our reports will prove useful in this regard. So, Mr. Speaker, that is the Auditor General's report. Thank you.
Thank you very much. Further debate? I recognize that member from Willowdale.